Hello, everyone. My name is Jasenia Carmona, and I'm the nurse manager for labor and delivery at Mount Sinai Hospital. I've been an L&D nurse for 17 years, and I'm certified in obstetrics and childbirth education. I just want to say thank you for inviting me to participate in such an important discussion today.
Hello, my name is Kelly Floyd. I'm the nurse manager for labor and delivery at Mount Sinai West. I've been in maternal child for about 19 years, an area that I love and I'm very passionate about. A nurse by background, and I have, in terms of credentials, completed a master's and a DNP in nursing, and I'm so happy to be here. Thank you.
Hello, everyone. My name is Calvin Lambert. I am one of the new assistant professors in maternal fetal medicine at Mount Sinai. And even though I'm new to the team, maternal mortality, Black maternal mortality specifically, is something that I'm very passionate about and something that I've researched on and talked about ad nauseum in my previous role as a fellow in maternal fetal medicine. So happy to be a part of this discussion and work with these other incredibly passionate individuals on the panel.
Hello, everyone. My name is Joanne Perrin. I'm the Patient Safety Coordinator for OB at Mount Sinai West. I've been a labor and delivery nurse for over 24 years. I'm also a certified childbirth educator, and I'm certified in electronic fetal monitoring as well. And I'm very excited to be here with you today to discuss this very important topic.
So, one of the question is, why is it important to call attention to Black maternal health? Um, it is super important to call attention to Black maternal health in order for us, not just the health community to be aware of it, but also for the population at large, especially the people who are affected, Black and brown people, because we cannot fix what we don't know. So by bringing awareness to the community, we can also educate them on what they can do to help to participate in fixing this problem with the clinicians, because the clinicians cannot fix it on their own. We need to partner with the community. We need to do community education. We need to look into health equity, because not all of us are in the same place. I may have the right resources to go to the doctor when I need. I may speak English. Maybe my neighbor doesn't. Maybe she doesn't know when she needs to go to the hospital. So therefore, that's why it is so important to bring this information to the forefront, to the radios, to the TV station, to the schools, to the high school, so we all know about it, so they can advocate for each other, they can support each other, they can remind each other, hey, this is the right thing to do in order for you to stay healthy. So I think this is very important for all of us to be aware of the state of health for Black and brown people.
I agree. I think it's incredibly important, and I think it's absolutely unacceptable that we live in a country in which there's such a stark disparity as far as outcomes with respect to maternity care. And I think that being able to kind of dissect this problem, it serves as kind of a microcosm in terms of some of the underlying concerns with respect to access, with respect to systemic racism that our country continues to deal with and needs to particularly face and address in order to ensure that everyone has a right to equitable care. And I think that by shining a light on Black maternal health, we're going to be able to continue to address some of these very, very important disparities that, if left unaddressed, we're going to continue to see more of the same negative outcomes for our Black birthing mothers. And I think that's incredibly unacceptable. And I know that this is something that people are beginning to become more involved and engaged in this discussion. And I think that being able to continue to sound the alarm, we're hoping to engage more people to act. And I think that that's the thing that's very important in terms of having these discussions. How do we begin to develop and inform and execute policies and procedures that are really going to make a difference? Sorry if that was too long.
I think that's perfect. I also want to add that we used to have it, we still have an issue with teenage mortality, but we used to have 118 per thousand teenage pregnancy about 30 years ago. We brought it down to 20 per thousand. And all of this is because we were all aware of it. All the grandmothers, the mothers, the schools, we all participate together in order to fix that problem. So we need to have the same approach in order to improve our maternal health mortality and morbidity.
What are the common racial disparities in Black maternal and infant health? The common racial disparities that exist are symptoms of this economic equalities, rooted racism and discrimination that exist. These differences manifest themselves with healthcare, insurance coverage, and the notable disparities also exist in the socioeconomic factors such as education, income, and honestly, we need to implement programs that help to equalize the health care that our Black and Brown birthing moms are receiving. And it shouldn't matter where they live because you do have to take into consideration poverty factors, social factors, experiences that may shape their outcome that they may have.
How can we improve Black maternal health? There are multiple layers that need to be addressed to improve maternal health that include both structural and individual interventions. But it's really wonderful that we're having these discussions because they really do need to be had. As stated by my colleagues, social determinants of health play a very important role in maternal health and really need to be considered and addressed. Things like, as mentioned, access to timely quality health care, level of income and education, access to food and housing have a huge impact on maternal health. And we have to remember that a key driver of social determinants is racism. And in order to address it, we need to acknowledge that racism is a present and current problem in our country and in the healthcare system. A great place to start, I would say, is awareness and education for our patients and our providers. Education really needs to start early, even before pregnancy. It's so important that patients understand their risk factors and how their risk factors will affect their health outcomes. They need to be aware of post birth warning signs. The theme of Maternal Black Health Week is this year is Our Bodies Belong to Us. And this is really so true. Patients have the right to receive high quality, equitable care, and they need to be empowered to speak up, to participate in their own care, ask questions, escalate concerns, and be advocates for themselves. It's really also a team effort, and having a doula and involving family or a support person in the care can really have a beneficial impact on their outcomes. Um, Patients also need to be familiar with all of the resources that are available to them, including how to access patient representatives in the event that they do have concerns with their care. A key takeaway that I really want to give to patients is that it's okay to be honest and to speak up. We're here to help you through this transformative experience, and we have a responsibility to take care of you. And our collaboration is of paramount importance to achieve the best outcomes.
I couldn't agree with you more. I think that the common thread through this discussion, as everyone has mentioned before, is social determinants of health and being able to raise awareness and acknowledge some of these systemic contributions to the outcomes and the disparities that exist between our Black and Brown birthing mothers
Mhm.
and other cohorts. I think that one of the things that, in reflecting on the theme for Black Maternal Health Week, is making sure that we continue to center the discussion about these disparities with the patient and finding opportunities to continue to empower and uplift those voices. I think when we're having a lot of these discussions, um, fortunately and unfortunately, sometimes it just happens to consist of providers, but I think that it would probably be more empowering and inspiring to be able to get some perspectives from people who are the results of some of these systems to be able to begin to brainstorm in a collective in terms of ways we can begin to be more proactive when it comes to addressing these particular issues and coming up with some solutions, some community-based solutions, day to day, we talk about how we can continue to educate people on the floor, our colleagues on labor and delivery and hospital wide. I think one of the best opportunities for us to get some um, inspiring education is hearing from the people who essentially end up being on the receiving end of some of these disparities. So I think that it's important for us to educate, but also make sure that we're centering our patients' voices, your voices, when it comes to finding ways in which we can address this and improve access to care. Because sometimes the solution may be as simple as changing times in which clinics are open or providing more opportunities for people to see their providers, knowing that given the current state of the economy, people are working longer hours, people have jobs that require their time, and we may not be providing them with the care that they need because our times are completely incongruent with the way that they function and run throughout the day.
What resources are most needed by healthcare providers to better support Black birthing people? As a healthcare provider on the unit, and I take care of budget, I want to say money, but it's not the solution. We do need money, but that's not all that is needed. We really have to think of the patient as the entire patient, as an ecosystem. That's what I mean by that. Knowing that if someone of Black birthing mothers, right, that these patients are children of enslaved people, and they are experiencing a lot of historical trauma that they may not be aware of, that the society is not acknowledging, that has definite consequences to their health. So that's one of the things we need to delegate resources to educate, not just to educate others who are not Black or others who are not brown, but everyone who is going to take care of that patient, and also the patient and their family themselves, so they know, listen, your pressure is high, it's not as high as other people, it's not because you're not eating properly. That could be true, but also you have something in your past that's causing it, so let's see how we can address it, so they can learn to have grace for themselves, to allow themselves to relax and say, you know what, it's not entirely my fault. There are certain things I can do, but there are certain things that come with me that I didn't bring, but maybe there's a way for me to address it. So that's where that awareness is from. We talked about resources. My colleagues mentioned systemic racism. Super important, because I am Black doesn't mean that I'm not going to practice systemic racism. So, for example, if we see two people coming to the floor and one person is Caucasian, one person is Black, I have to tell myself, I don't want to be the physician. But the first thought that comes is the person who's Caucasian is the physician. So I have to retrain myself in saying that any one of them can be. So by doing that, you're putting everyone in the same level field where they can be anything and everything, and then you're going to start treating people the same way. So we need to put resources into that to re-educate the society. Funding for the schools, for elementary, for high school, we need to start there. We need to tell these kids that this is what's happening. How you eat well, how you take care of your stress, what happened back in the days, this is going to affect you. And maybe you're going to have a higher blood pressure than your counterpart who was born somewhere in Africa where their ancestors were not slaves. So when they're going to approach their lives, they're going to take that into consideration as well. And we talked about equitable healthcare, health insurance, that I may have private insurance, that it's easy for me to find a physician. We need to find resources where this patient can know exactly where to go when something is wrong. We need to be able to have community resources that they can call and say, hey, I'm pregnant. I have 2 kids at home. I just fell, but I don't have anyone to babysit my children. But I really need to go to the hospital to see if my baby's okay. If there's no resources for that, she's going to stay home. By the time she gets to us, that baby may be dying, or that baby may be dead. So that's why I call it a wraparound services, where if it's wraparound, it's going to be equitable. So if I'm making enough money to have all the services I can pay for someone else, there's going to be the local government or the federal government who's going to provide those resources, so that at the end of the day, we don't have to have those catastrophic events because we are able to catch it early. So it's all about prevention. and the hospital system itself, they're going to be able to react when someone comes and they're super sick, that we are trained well on knowing how to save that person's life, how to not having any situation where we fail to rescue the patient, we fail to do what we were supposed to do in order for that patient to walk out alive as much as possible within our powers. So in summary, I studied by talking about awareness, being aware of how we get there, be aware of the resources that we have, be aware that everyone is not starting at the same place, but that we can get everyone in the same place, and that it's a journey. It's not going to happen tomorrow, but we can start it.
What factors in healthcare have led to the disparity in Black maternal and infant health? The factors in healthcare that lead to disparities in Black maternal and infant health are things we've already mentioned, such as inequitable healthcare. We want to provide equitable healthcare to everyone across the continuum. And there are government programs that have started, such as a blueprint for addressing maternal health crisis, that actually takes a look at the care that our mothers are receiving in different areas of the United States to make sure that they are receiving the same care that areas or that are have better numbers or better rates in maternal and morbidity rates are receiving. Another factor is, of course, our moms, they're just not being listened to. So, as healthcare providers, we really need to make an effort to put our own biases aside and listen to what our patients are trying to communicate with us. We have to understand their social and economic situation as well. And just being able to properly assess what's going on and how you can help and provide the support that these birthing moms need is extremely important, whether it be, like I said before, changing clinical hours or providing transportation, finding out, do they have food? Do they have the proper food to eat? A lot of our Black and brown birthing moms, they experience a lot of preterm labor. They experience other healthcare issues that go along with their pregnancy that can be related to their social and economic situation. So even providing referrals to community resources is also would be a big help.
How can healthcare providers be more aware of these factors in practice? We need to closely examine how we practice and identify disparity and biases. A very insightful quote that I'd like to share with you is: "We see the world not as it is, but how we're conditioned to see it." And I think that's very important. It's essential to practice self awareness and reflection in order to understand our own unconscious biases and to understand how we utilize stereotypes in our own practice. It is our responsibility to develop cultural awareness and sensitivity. We need to meet patients where they are, as Ketty stated, and deliver respectful care where we're asking and listening to our patients, not just telling them what's happening. We need to be open to shared decision making and include patients in their care. And I can't stress the importance of taking the time to build trusting relationships with our patients and really getting to know them, because that is the building block to be able to have the difficult conversations that may need to be had. We also need to hold each other accountable as a team and speak up when we see biases that lead to these disparities in practice. I mean, it really is an honor and a privilege to be able to help families through their birthing process. And the collaboration and relationship that patients have with the healthcare team is really, really of paramount importance and will make all of the difference for them.